Hi everyone, the weather is getting hotter and hotter. In this video, I'm going to share with you how to deal with this heat wave. Hi, I'm Dr. Mark Yap. I'm from Cashew Medical and Surgery. I'm a family physician and I've been practicing for 23 years. The current heat wave in Singapore is hitting new highs. So every day we are getting higher and higher temperatures, up to 37 and maybe soon up to 40 degrees. So in my practice, I've been seeing quite a number of heat-related conditions and also injuries. So common complaints are heat rashes, heat cramps, people are more complaints for headache, tiredness, dizziness, lethargy. And because of the heat, some people are more accident prone, so I've been seeing more falls, more injuries of late as well. Extreme exposure to heat can cause illnesses and aggravations of medical conditions. This goes across all age groups. Young infants and babies cannot indicate that they are dehydrated, so that puts them at risk of dehydration. For elderly people, their chronic conditions such as diabetes, hypertension, cholesterol, blood pressure, even asthma can get aggravated because of heat-related problems. Heat-related conditions can start from very mild conditions like heat rash, heat cramps, to more serious conditions like heat exhaustion and even a heat stroke. For mild conditions, usually it's common sense, common advice. So the advice I'll give my patients is that make sure you get adequate rest, adequate hydration, drink lots of water. Stay in a cool environment, if possible, stay in an aircon environment. If you have to work, sometimes switching your work lifestyle helps. If you can work through the night and rest in the day, it may be useful. Of course, staying indoors is recommended and minimize outdoor exposure. If you have to go outdoors, you'll be advised to use sunscreen, sunblock, and even sometimes carry a portable fan around if it helps. For long activities exceeding more than half an hour, every 20 to 30 minutes, it's good to take a break, have a cup of water, and monitor your urine output. If your urine is clear, that means you're adequately hydrated. If you have no urine or your urine is dark colored, means not adequate hydration. For more serious conditions like heat exhaustions, it may appear as very mild symptoms like headache, dizziness, nausea, vomiting, leading to cramps, and then even loss of consciousness. When loss of consciousness comes in, you must always think of possible heat stroke. And in such cases, we have to call 995 or send the patient to an emergency department. The existing heat wave will have implications on coexisting morbidities. For patients who have diabetes, hypertension, and other chronic illnesses, I encourage them to continue with their medications, not to stop and forget medications, and to follow up with their family physicians regularly. And if they experience symptoms such as headache, dizziness, please do not assume that it is just normal or mild symptoms, but make adequate steps to check their medical conditions to make sure that their blood sugar, for example, is adequately controlled. I've also noticed that asthmatic patients are more prone to asthma recently. This could be heat-related as well. The early warning signs of heat-related conditions are actually very non-specific, so we need to have a high index of suspicion. If you have not had adequate rest, you have been tired, you're feeling lethargic, you have not had enough access to water, symptoms such as nausea, vomiting, dizziness, lightheadedness are all early symptoms that you should be aware of. But the moment you start having cramps, you started having loss of consciousness, then it is time for you to see a doctor immediately. Preventive measures of heat-related disorders starts from yourself. As an individual, you have to be responsible for your own health. Make sure you get adequate rest, 6 to 8 hours of sleep per day. Make sure you get enough hydration, drinking up to 2 liters of water or more if necessary. And making sure that when you are outdoors, you get adequate rest and prevent injuries. From a family's point of view, parents should make sure that kids have more indoor activities and stay at home and have less outdoor activities. From a company's point of view, it is important for the employers to ensure that employees are well looked after, and for employees who are working outdoors, they should have more rest, adequate measures to observe each other, and make sure there is enough water to go around. From a country's point of view, I think it is important that the countries look at measures where we can go green and we go carbon free so that these heat problems will not be a yearly recurrence. Subscribe to Medical Channel Asia for more videos just like this.